Well, I'm Dr. Jenny Cate. I'm a third-year maternal fetal medicine fellow at Duke University. And here I have...
I'm David Arnoff. I am an infectious disease physician. I'm also the chair of the Department of Internal Medicine at the Indiana University School of Medicine.
Wonderful. Well, we are very excited because we're going to be speaking on a review article that Dr. Arnoff and Dr. Marazzo co-authored together entitled Infections Caused by Clostridium perfringens, and I'm so excited to say this next one, and Clostridium sordellii. Was that close?
You nailed it.
Crushed it. After unsafe abortion. So with the change in the abortion landscape across the U.S., the rates of unsafe abortion are very surely to climb. So in your review article, it outlines two potentially devastating clostridial infections that can occur in the cases of unsafe abortion, and most importantly, the recognition of these clinical scenarios and prompt early intervention and treatment to avoid severe morbidity and mortality. Why do you think a review article like this is so important in the current state of our legislation and the constraints on our medical practice?
Yeah, I mean, Jenny, that's a really important question. I think my interest in this has grown a lot from the fact that as an infectious disease physician, I also happen to do research in bacterial infections that complicate pregnancy, reproduction, and reproductive choice. And some of that work has involved studying these very serious infections. Clostridium sordellii used to be called Clostridium sordellii, and in the early 2000s there were a cluster of cases of young women of reproductive age who suffered from toxic shock syndrome caused by, at that time called Clostridium sordellii, and they were really striking infections, and that prompted me to start doing some research to understand better how this happens. And at the time, one of the things that was important for me to realize is that those infections were really rare. They were tragic and really hard to treat, and the mortality rate was really high, but they weren't commonly seen. And the more I learned about those clostridial infections that could complicate abortion, the more I recognized that the risk of those infections was higher when abortions were not safely performed. And abortions are generally not safely performed when they're against the law. And looking back at the history of these infections in the United States, they were for sure more common before abortion became legalized. And so recently, as you mentioned, we've seen changes to the laws restricting access to safe, legal abortion. And when we started to see these laws change, I really started to worry about the fact that we know that when abortions were performed in unsafe ways and illegally in our country, people suffered from severe life-threatening infections. And I think it's predictable that we will see more of these. And so as somebody who was learning about the infections and thankful that they were rare, but now worrying that we would see a rising tide of severe life-threatening clostridial infections, I felt like the time was right to review these for people, and I partnered with Dr. Marazzo, who is a long-standing champion of reproductive health and infectious disease expert, somebody who has seen serious infections of the reproductive tract. And the two of us really worked together on this review to make it accessible. We purposefully published it in a journal that wasn't specific to reproductive health. We wanted there to be a wide readership. And the purpose was really to get it on people's radar that we may start seeing these life-threatening clostridial infections again.
No, I think that's what's really important about this, especially as someone who just came out of training a few years ago in an era where the legislation was very different, and I trained in a state where the legislation was very supportive of safe abortions. And so as a trainee and someone who's going to enter into attendinghood soon, it's really important to understand how to identify these patients when you're seeing someone who's very sick in an era where I didn't see that in my training. And so how can I gain that knowledge from reviews like yours in order to use that in my practice. So I think it's very timely and was very helpful for my reading. Were there any messages that you were hoping to really convey with your article to your readership?
Yes, I think these infections remain uncommon. Hopefully they'll remain uncommon, but I do think that we're likely to start seeing them more frequently. And so one of the messages was to alert people to how these present clinically, so that an astute clinical expert, whether they're a reproductive health expert or a family medicine physician or advanced practice provider, seeing somebody who is post-abortion and has signs or symptoms of one of these severe clostridial diseases might be alerted early enough that something could be done to make a difference and change the trajectory of what is unfortunately generally a fatal illness. And so a lot of what the article was about was helping summarize some of the clinical features of both Clostridium perfringens, toxic shock syndrome, and Clostridium sordelii in a way that would maybe put some unique features into the minds of people on the clinical front, so that when they're seeing somebody of reproductive age who they learn has recently been pregnant and may have terminated a pregnancy, that they could start asking the right questions and maybe accelerate care if needed.
Yeah, no, I found that it was really helpful, especially I actually had a patient the other day that I thought about clostridial even before I read your review article, but it was helpful to identify some of the parts that were significant for that presentation, and also how to incorporate that when you're evaluating patients as something to keep in the back of your head as necessary for intervention right away in order to, like you said, change the trajectory of their outcome. Now, I thought there were lots of strengths to the article because I thought it was a great read, and actually I had read it even before we had suggested it, so it was a very helpful thing for me to be able to kind of identify, okay, what do I know about this, and what can this add to my understanding? Now, from your perspective, what do you think the strengths of the article was, and do you think there's any weaknesses or anything that you wish that you could expand upon?
Right. Well, I think a strength of the article is that we do present some context. As you mentioned, we talk about a little of the history of abortion, reproductive rights, and what bad things can happen when safe abortions are not accessible. We talk about clinical features of these clostridial infections, and we give guidance on how we might diagnose the infection and treat. I think one of the disappointing things for me is that there isn't a great, strong evidence base for treatments that will save lives in these infections. Part of that is, thankfully, these infections are rare enough that it's hard to do big studies. But the flip side is that we're still sometimes stuck treating with anecdotal evidence or evidence that's from many decades ago. And as I was partnering with Dr. Marazzo writing this, I think there was a feeling that it would be nice if we had newer therapies that were well studied and likely to make a true difference. And so I think that's a relative weakness of the paper, is that the state of the art doesn't feel as cutting edge as perhaps it could be, because a lot of it boils down to source control, making sure that infected tissue is removed, and using antibiotics that are active against Clostridia or Clostridia, and doing fundamentals of intensive care. But one can't help wish that there were better molecular tests. One can't help but wish that there were better, perhaps monoclonal antibodies against the toxins that are driving the severe shock. So I do think that that's sort of what I hope another chapter in the story might be sooner than later, would be that we have some new things to offer to either prevent these infections from occurring or saving lives once we make a diagnosis.
Well, I think you actually hit my next question on the head, which is, where does our research need to go in order to take the best care we can of patients who are faced with unsafe abortions and complications like this, and I know you mentioned already some of them. Is there anything else that you think with your area of expertise that we need to think about from a reproductive health and a abortion legislation perspective on what areas of research we need to focus on in the upcoming years?
Well, I think from a policy side, it's clear from global political experiments that have been done where governments have made laws against safe abortion, that when those laws go into place, people still have abortions. They are just unsafe and lead to increases in death and illness. So, obviously I would like to see better access to abortion, safe abortion, legal abortion, and reproductive health. That's something that we're going to have to work on moving forward. I think specific to these infections, I hope that molecular diagnostics continue to become not only better, but affordable, so that when a person comes in very sick, we already know that it's unlikely they'll have a clostridial infection just based on probability. People in septic shock may be more likely to have a strep infection like group A streptococcus or Staph aureus or even E. coli. So it would be nice if we had ways very quickly to help us narrow the field and understand, why is this person getting ill in front of us? Is it a clostridial infection? Is it not? And at the same time, have molecular testing that guides us towards therapy. That's particularly important for bacteria that are starting to get resistant to antibiotics. Unfortunately, with anaerobes, bacteria that need that need no oxygen to grow, we don't really do very much antibiotic susceptibility testing. So we actually don't know what's going on with Clostridium perfringens and Clostridium sordelii in terms of antibiotic resistance. So it'd be nice to have more information about that and be able in real time to know this person is infected with, let's say, Clostridium perfringens, and it's resistant to this drug, but it's sensitive to that drug. I think that would be very helpful. And maybe in the future we would see vaccines to prevent these in high-risk patients. The problem is we don't yet know how to identify the highest risk of patients. And lastly, I think some targeted therapeutics beyond antibiotics. These diseases, Clostridium perfringens toxic shock and Clostridium sordelii toxic shock, are driven by toxins. They are really intoxication illnesses. One of the fascinating things about Clostridia in general that cause human disease is they all do it through toxins. Botulism is a Clostridium botulinum toxin, and we can prevent that or treat it with antitoxin. Clostridium tetani causes tetanus, and that's a toxin-mediated disease. Clostridioides difficile that causes C. diff colitis. It's toxin-mediated, and we actually use antitoxins, monoclonal antibodies against some of the Clostridioides difficile infections to treat that. And then we have perfringens and sordelii. And unfortunately, unlike difficile, tetanus, and botulism, we don't really have antitoxin therapies available for sordelii and perfringens. And I think that's a really important area where we could have therapies that, while they're not used very commonly, they could save a life. And if they were warehoused somewhere regionally, like it's the CDC or regions across the world or the country, that when somebody is presenting with that infection, just like when somebody comes in with botulism, we could get antitoxin to them and potentially save their lives.
No, I think you really expanded so perfectly on what we need, which is rapid identification and then the ability of effective treatments. So I want to thank you, because even after reading your review, I just learned so much from you, and I hope that everyone goes and takes a look at this, because as we move forward in this current landscape, we need more information. We need to look to our future as to how to best take care of these patients, and then also how to advocate for them.
Well, thank you very much. It's really an honor to be interviewed about this work. I do want to shout out to Dr. Jeannie Marazzo, who was my partner in writing this article. I also, of course, want to emphasize that abortion is healthcare, and it's important for us to continue to provide safe and legal abortion to reduce the risk that these tragic infections occur. And even when somebody survives, a serious infection after abortion, they can be left with psychologic and psychiatric trauma. They can be left with physical trauma, sometimes even without a uterus later, really restricting their choice for reproduction later. So thank you for the work that you do. Thank you for engaging us in this conversation. I think it is really timely and important. And I hope that the future is brighter.
Me too. Well, thank you so much.